Hello everybody, we will be using the balance error scoring system test today to measure one's postural stability. It is used as a sideline evaluation for concussion protocol and different types of sporting events. And it is also used as a rehabilitation tool to measure one's improvement or decline in their balance. It can be used anywhere. It's a cost-effective and easy test to perform. The only equipment needed for the balance error scoring system is a medium density foam pad, a scorecard, and a timer. And the timer can be used from your watch or your phone.
This will be the scorecard we will be using to evaluate. On this side, it has the definitions for the errors we are looking for. On this side, it has room to write down the errors. It has a space for each stance and for the firm surface and the foam surface. What we do is we take the total errors from the firm surface and the total errors from the foam surface, and we add them together to get our best total, which is what we use in our evaluation.
Okay, so for our pre-test instructions, we do not require a warm-up for the balance error scoring system. There's possible fatigue that could affect the test, so we just have the participants go straight into the test. Height, weight, sex, and age will be collected for the data evaluation. There are 2 requirements for our test that we will be doing. One, they have to be in the Kineseology 306 class, and then the other one is they have to have no lower extremity injuries. Test procedure, there's 2 surfaces, there's foam and firm, and then they have a variety of stances, double leg, tandem, and single non-dominant. It's a 20-second variation for each of these stances. And then there are 6 types of errors. The first one is if hands are lifted off of the iliac crest, if you open your eyes, step, stumble, or fall. The 4th is moving hip into greater than 30-degree abduction. 5, lifting forefoot or heel. 6, remaining out of test position for longer than 5 seconds.
Common mistakes in procedure can include testing the wrong leg in the stances. It can include doing the stance outside of the 3 that we're using. It can include not being specific in the definition of errors, as well as not using the total best score in evaluation.
For this test, the participants are asked to take their shoes off. The stances that we will be doing for this test, starting on the flat surface. First is double leg stance with your feet together. The second one is single leg stance, non-dominant foot. We need to make sure it's non-dominant. And then the third is tandem stance with your non-dominant foot back. These stances are repeated on a foam surface, starting with double leg stance, then single, non-dominant, and tandem, which you might have to move to be able to fit your feet.
Our participants' total best score was 12. Compared to our normative standards, this would put her in the broadly normal category, which ranges from 8 to 14 errors. And since she is in that normal category, she has little risk for falling or becoming injured later in her life.